Basic Suturing by Carla Kate Cueva. It is a surgical technique where you stitch up a wound to promote tissue healing. For the materials, we will be needing surgical gloves, anesthesia, surgical scissors, a pickup forceps, a suture, a suturing pad or any alternative, a needle holder, and a 10cc syringe. Infiltration of local anesthesia. You will need the syringe and the local anesthetic of choice. The anesthetic bottle is considered unsterile, so remember not to touch it with your gloved hand. The first step is to aspirate the local anesthesia from the bottle while observing sterility and safety. As for the dose, you can compute how much you're going to give for the patient before aspirating. The next step is the removal of air from the syringe. Inject the local anesthesia with a bevel up on the desired areas subcutaneously. Always remember to aspirate before the injection of your local anesthetic contents to make sure that you have not hit any subcutaneous blood vessels. You'll know that a vessel is hit when there is a backflow of blood into the syringe. Check the effects of the local anesthesia using the tip of the needle. The onset is around 2 minutes, so you can check around that time. Simple interrupted suturing technique. We will need pickup forceps, the suturing pad, the suture, surgical scissors, and the needle holder. First off, you need to know how to handle the instruments properly. With the dominant hand, place the ring finger and the thumb on the needle holder in a prone position. Your other hand will hold the pickup forceps in a pencil grip or a pencil grasp. Next will be the proper loading of the needle. Use your pickup forceps to hold the needle. Then, position the needle at the tip of the needle holder. The needle is held 2/3 midway. Remember not to touch the needle with your hands. Start suturing 1 centimeter from the edge of the wound perpendicularly. Gently rotate the wrist, following the arc of the needle until it exits on the other side of the wound. Once it exits, adjust the length of the suture. Next, perform an instrument knot tie or a square knot. Ensure that the knot is tightly done to ensure wound approximation. The knot is usually placed on one side so the healing process of the wound will not be disrupted. Next, prepare to cut the excess suture. Handle the surgical scissors properly with the ring finger and the thumb in prone position. Then cut about 1 centimeter from the knot. The whole procedure is repeated along the entire length of the wound. Lastly, test the integrity and strength of the suture.